Inflammation. You know what is infection? You know what is in by inflammation? See, again, like I'm repeating. So, infarction. Okay, infarction. Okay, inflammation. Again, back I'm repeating. Infarction, inflammation, infection. Like this, many technical terminologies are existing. So we need to know the difference among all. Okay, okay, yeah, myocardial infarction. This guy took a lot of stress into this particular body by thinking a lot of negativity. As a result, what happened is the heart muscle uh, gone for wrong contraction and relaxation. So wrong contraction and relaxation of the heart muscle, wrong contraction of the heart muscle. Okay, we are observing in the case of myocardial infarction. So when you are having a wrong mismatch in terms of thinking, attitude, in terms of correlation about the negativity with your own personal life, then what will happen is you'll be having the improper amount of heartbeat. As a result, what will happen is basically the particular individual will feel the difficulty in heart pumping mechanism. So the heart muscle misappropriate contraction and relaxation, we used to call as myocardial infarction. Infarction impact is called infarction impact. Again, back I'm repeating, infarction impact is called infection. Infection impact is called infection. So infection impact is called infection? No. Infection impact is called inflammation. So can you say some example for the inflammation? The skin is becoming red. The skin is getting boils. The skin is getting cracks. The skin is getting rough and tough. So these are all the examples for the inflammation. The infection, very good example is the microorganism invaded the particular cell. All the microorganism not likes all the types of cells. For example, now only we discussed the malarial parasite. Okay, not likes the lung cells. It likes liver cells very much, RBC cells very much. That is red blood cells very much, but not the brain cells, right? But not the lung cells. So the specific cell is invaded by the microorganism. That condition we are calling as infection. The infection impact is called inflammation, and infarction is because of the misappropriate muscle contraction relaxation. So many terminologies we should keep in our mind before entering the chapter. We know very well about the immunity is coming because of many reasons in the different season. Okay, some are acquired. We are acquiring naturally. Some we need to get it done with the help of vaccine introduction. You know very well. Okay, I took this vaccine and now I become normal. Okay, so certain set of individuals are saying in this particular winter season. For example, I had a flu shot. I had a flu shot. So in my body, plenty of antibody produced. So I'm normal now. So I not took the flu shot. So many number of time, my friends has advised me, but I not took that particular flu shot. So I'm experiencing the issues. So like this, what we need to be very specific in understanding the micro difference about among the various infection terminology. You know very well the immunity is totally different from immunology, is different from immunization. So immunity, immunization, immunology, right? The study of the immune system is called immunology. Immunization. I took vaccination. That is a type of immunization, right? So then, if you're talking about the innate immunity, means I'm having this immunity from the childhood age, right? Innate immunity, I'm having this immunity from childhood age. Okay, so that is called innate immunity. So the quite antonym of the innate immunity is acquired immunity. So synonyms of each and every particular terminology and antonyms of each and every terminology and examples and the appropriate narration about each and every example. Discussion is very, very important internally into your mind, so that what whenever they're asking the question, you can say the answer more appropriately, right? So here we discussed the different type of immunity. Okay, see, basically the credit goes to our Edward Jenner. So as I already told you, the Edward Jenner was a great scientist. He was the father of immunology. What he did is he discovered the vaccine, which is working against the cowpox virus, uh, also works against the smallpox virus, right? Cowpox in cow, smallpox in human, right? The vaccine having full of antibody against the cowpox also kills the smallpox is nothing but variola virus. Variola virus. Variola, varicella, right? So these all things they're not given in the CBSE textbook. This variola virus, varicella virus, they're not given in the book. There is a reason why we are having a control over the tongue, and we are not discussing the microorganism name much more in detail, right? So now, if we're talking about the disorders, I already told to you a number of time, might be genetic, might be non-genetic. What do you mean about that? Okay, some disorders are getting inherited for very number of generation. Uh, for example, you know very well in atomic bomb blast of Japan uh, period, there are a lot of genetic disorders arised, and even now also a few people are coming to the world in Japan with a genetic disorder. But that is not the case with all the genetic disorders, right? Some genetic disorders are inherited, some genetic disorders are not inherited, and some are carriers of genetic disorders. So that we need to understand in detail, right? So we need to understand about the basic information about the innate immunity. So we know very well immunoglobulin. Immunoglobulin. So what do you mean about immunoglobulin? Is an antibody which is symbolized with Ig, or else we can say with the other notation is nothing but capital A and small b, which is nothing but the antibody, which is not formed by all the white blood cells, only formed by a specific type of white blood cells, which is nothing but the B lymphocyte. The B lymphocyte is having the credential to make a classic type of antibody, which is nothing but the which is nothing but what? Five different type of antibody. Five different type of antibody. How we can remember gamed like this? You remember GAMED. So antibody G, antibody A, antibody M, antibody E, antibody D. So these three number of antibodies are formed by the B lymphocyte after experiencing the microbe attack in our body. So who is mediating the microbe exposure to the B lymphocyte as nothing but lymphatic vessel, which is quite organized in the sense of, okay, these lymphatic vessels are having the lymphatic fluid in it, okay, which is making the white blood cells to get migrated for a long distance. These white blood cells are very, very important for giving the immunity. Now, we are entering into the important immunity concept called innate immunity. This innate immunity, I already told to you, that is from childhood age, right? It is existing. If you're talking about the first line of defense in our body, uh, in this particular rank, who are all the examples we can discuss in detail. If you're talking about remarkable ability of the defense itself against the foreign invader, like the foreign invader. So remarkable ability to defend itself against a foreign invader. So if you're talking about uh, the collective defense mechanism is called immunity and comes to two primary form. One is innate and acquired immunity, right? So innate means from the childhood age. Acquired means after getting exposure to the microorganism, you're developing the immunity, right? So now, can you see this? The God, or some will say God, some will say nature. Okay, uh, here has given quite a lot of different soldiers, that is white blood cells. But in meanwhile, uh, we need to discuss about the various different soldiers also before entering into uh, the main defense mechanism. So you know very well the first line of defense. Okay, in this particular category, we already narrated innate and acquired immunity, right? In the innate immunity, it is from the childhood age, like this you told already, but you don't give the example for it, right? So whenever they're asking the board exam question, we need to emphasize examples also, explanation for the examples also. If it is 3 mark, if it is 1 mark, innate immunity is immunity we are observing from the childhood age, which is given by mother. Like this, we can give the dot. Example, the colostrum, a liquid which is given by the mother before breastfeeding. Like this, we can end up. But if it is 2 mark, we need to increase the number of sentences. If it is 3 mark, we need to increase the number of sentences, right? So examples, an explanation of the examples before the definition of the particular topic, whatever they're asking, should be narrated appropriately, point by point, instead of paragraphic representation. Now we were talking about a physical barrier, right? The physical barrier, very good example is skin covering our body. Primary physical barrier that blocks the entry of the microbe, that blocks the entry of the microbe, that blocks the entry of the microbe. We know very well, the skin is the biggest organ of our body. Okay, the biggest organ of our body, skin, is maintaining our body temperature consistently in most of the instance, except the microbe infection area. In the sense, for example, I'm in a very cold climatic condition, so my body temperature is coming down here because the temperature level is coming down because of the chillness, because of the humidity content of the atmosphere, right? So skin is playing a crucial role in maintaining the consistent body temperature. So you know very well the mucous lining of the respiratory tract and digestive tract and urogenital tract is playing a crucial role in trapping the microbe, right? So this mucus is having quite a good number of antimicrobial components, which takes the microbes so that the microbe can't enter freely into the body through these many number of tracts. GI tract is a digestive tract. Respiratory tract is nothing but a breathing tract. Urogenital tract is nothing but a reproductive tract. Multiple terms they will use in the board exam. Urogenital tract, also called as reproductive tract. Gastrointestinal tract, also called as digestive tract. Respiratory tract is also called as one breathing tract, right? Now we are coming for physiological barrier. Several physiological factors are acting as a barrier. We know very well the stomach HCl secretion is not allowing the microbe to sustain and thrive more efficiently. Saliva in the mouth, saliva in the mouth is having quite a lot of lysosome, quite a lot of lysosome, quite a lot of lysosome. You know very well lysosome. We used to write Z. This lysosome is having a lysosome enzyme to kill the bacteria. The tears in the eye is having plenty of antimicrobial components to kill the microbe, right? If you're talking about cellular barriers, in this particular heading, we can bring the T lymphocyte as a beautiful example to defend the microbe. Means how the amoeba engulfs the food in the same way, the microbes are engulfed by a few set of WBZ, 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 which is nothing but the neutrophil. So you know very well about the neutrophil. It's a type of WBZ which is very very important for making the microbe to die. Right now we are entering into see again back I'm repeating neutrophil engulfs microbe like amoeba. Okay, but amoeba is not engulfing the microbe. Amoeba is engulfing the food. Okay, similar to amoeba engulfing, the neutrophil is engulfing the microbe, right? So be very careful. In addition to all these things, what else we should supposed to know is, you know, very well in the case of saliva, the antimicrobial components which are present in the saliva, which kills the microbe, which kills the microbe that we already told you, right? We know very well in the HCl secreted area of the human being. HCl secreted area of the human being means what? Where exactly you are saying? Stomach area. In the stomach area, because of the HCl secretion or acidity condition, microbes can't sustain like this. I can say for most, but not for all, because certain microbes will survive, will thrive very nicely in this acidic condition. For that, I already had given the example long back. Helicobacterium pylori will sustain in this HCl secretion as well. So there is a reason why we are saying we should not supposed to use all. Only most of the microorganism can't sustain, whereas few microorganisms can sustain. For that, the very good example is Helicobacterium pylori, which is a classic bacteria can invade the stomach. All right. We are okay, whenever you're keeping on discussing all these things. So what is coming to your mind is, for example, if you're taking plenty of chili, so acyl secretion is becoming random, right? And now we are coming for the next phase explanation is cytokine barriers, chemicals, how it is bringing the defense system. For that, the very good example is intron. What do you mean introns? Introns are basically an antiviral protein, which is not given in the slide. This antiviral protein, the word they will use for interference, which is produced by the virus infected cell. The virus infected cell releases this interference. This interference, after getting entry into the infected cells, uh, this will make the infected cell to produce furthermore defense mechanism against the microbe. Once again back, I'll say to you, microbe infected cell produces interferons. Interferons is entering into the neighbor cell and making the neighbor cells to be more clever to defend the incoming microbe. For that, we need the proper cellular nutrients supplementation. For example, you know very well, zinc, vitamin E is quite amazing in supporting the lymphocytes to make quite a good number of antimicrobial components, and also the virus infected cell also making the interferons at a very good quantity. If we design the proper vitamins and ion supplementation, very good example is zinc and vitamin E are very classic in making the cell to support the antimicrobial components or antiviral components, which we used to call as interferons, right? So next concept is, if you're talking about the acquired immunity and innate immunity, or two different type of immunity. If you're talking about the acquired immunity, you're acquiring the immunity after getting the infection. That is what is called acquired immunity. Okay, and this is some acquired immunity are curable, some are non-curable. Okay, like this, we can bifurcate. So some acquired infection can be cured with acquired immunity. For example, I'm having the typhoid infection, I'll recover. If I'm having the HIV infection, I can't recover. If I'm having the hepatitis B infection, okay, I can't recover. Okay. If I'm having genital warts, I can recover. So, recoverable acquired immunity, non-recoverable acquired immunity. Okay, recoverable, non-recoverable. Under this, we can discuss the acquired immunity. So they will bring the multiple toughness. So acquired immunity is very easy. Define acquired immunity. They won't ask. What do you mean by acquired immunity? Give example like this. They won't ask. Can you discuss acquired immunity in the recoverable diseases? So recoverable disease and non-recoverable disease. So acquired immunity is not supporting. It's not supporting the non-recoverable diseases. Non-recoverable diseases, right? So now innate immunity is from the childhood age onwards. They are having the immunity, right? Now, from the childhood age onwards, some children are having that immunity because the mother had given that immunity not only through the umbilical cord while developing the baby in her uterus, and also by feeding the colostrum and milk during the lactation period. So, in the lactation period, before giving the milk, they will be giving the colostrum, which is a yellowish fluid that is also rich in antibody, right? So like this, we need to think in our immunity level in many ways. Now, before entering into the acquired immunity, any one of you are having any doubt, please let me know. I'm going to the acquired immunity. In the acquired immunity, you are acquiring the immunity in certain time period. In certain time period, you're acquiring the immunity. Okay, in which way you're acquiring the immunity? After the microorganism infection, right? After the microorganism infection. So, if you're talking about the primary immune response and secondary immune response, like these two type of immune response are there. If you're talking about the acquired immunity, okay, can you see this particular narration? The antigen presentation means microorganism is presented to the cell, which is a neuron, what we narrated here. Okay, here antigen is presented to this particular dendritic cells. Okay, and which is supported by the T lymphocyte. Okay, and MHC is nothing but major histocompatibility complex 2. Okay, so this MHC And the T lymphocyte, how it helps in making the microorganism to get exposed to the particular defense cells. They're not narrated in detail. So just we will say the overall view alone, okay, for facing the board exam. So if it is a neat preparation class, then we can go in detail furthermore in depth. So now you know very well these dendritic cells, after getting exposure to the microbe, it understanding this is the nature of the microbe. Accordingly, this particular cells, which particular cell, the WBC cell, is making a specific set of memory cells and effector cells. These effector cells are making the antibody. These effector cells are making the antibody. These effector cells also I can call as plasma cells. The CBSE board paper, they will ask, instead of saying effector cells, sometimes they will say plasma cells. Plasma cells makes the antibody, right? And also it releases certain cytokines. These cytokines are a classic chemical which makes the defense soldiers a little bit more active. See, for example, let us consider the defense soldiers. Okay, whenever they are trying to invade one particular area, they will go with weapons, right? And also they will go with certain nutritions, help support. Okay, like this, if you are keeping this entire nutritional life cycle in the immune system, the proper nutrient circulation to the defense soldiers, the proper activation of the defense soldiers like WBC, and the differentiated WBC is taken care by cytokine. Why? Because the cytokine is like a steroid drug. It's not a steroid drug, of course. The cytokine acts like a potential giving drug. So potential giving drug. So I'll perform a little bit much more greater than the normal. So this is because of cytokines, right? So the cytokines makes the defense soldiers to be more aggressive in terms of developing the defense system against a specific microbe. But because we need to handle the fungus in a different way, we need to handle the bacteria in a different way, we need to handle the virus in a different way. So accordingly, we need to prepare the different type of defense system, right? So now we are entering into the next major point is uh, before entering to the acquired immunity, we are going to the antibody structure discussion. Keep your mind in detail. So acquired immunity, of course, we told in the overall view with the proper flowchart, and then now we are entering into the antibody structural explanation. In this particular picture, can you see this place here? Here, the heavy chain and light chains, like this, two chains are there, right? Heavy chain and the light chain, two chains are there in the antibody. Having a different type of regions, basically in the antibody, in the center of the uh, heavy chain, between the two heavy chain, you can see this particular area is called hinge region. So what do you mean about hinge region? Any one of you can say? So when the microorganism is entering into the antibody structure, okay, the hinge region is given the flexibility. Hinge region is given the flexibility. So what do you mean about flexibility? So you know very well in this particular area, uh, so the microbe need to get attached. Okay, so that flexibility is maintained by the hinge region. Again, back I'm repeating, hinge region is present in this red square wherever I marked, and that hinge region makes the microbe attachment to the antibody more appropriately. Okay, I am not saying microbe is getting attached to the hinge region. Hinge region makes the microbe to get attached to the antibody anywhere more flexibly. The antibody, specifically in the heavy chain, it is having a specific area called, okay, FAB area, fragment of the antibody. We also fragment of the antibody. FAB area of the heavy chain is having the classic interaction segment for the microbe. Hinge region is given the flexibility. Some microbes are big in size, some microbes are spherical, some microbes are spiral, so or some are rod shaped. So depending upon the microbe, the antibody structure is changed, right? So now we are entering to the next major point is antibody are the essential components of the immune system, humoral response. Humoral response. So antibody mediated response is called humoral response, right? So now we are entering into the next major segment. You know very well the B lymphocyte and T lymphocyte are playing a crucial role, but antibody can't be formed by the T lymphocyte, whereas B lymphocyte makes antibody. So B lymphocyte can't engulf the microbe, whereas T lymphocyte does the engulfing of the microbe, engulfing in the sense the taking the microbes into its own structure that we used to call as what? Engulfing the microorganism is called phagocytosis. For each and everything, certain specific technical terminology is there. So that if you're not writing while writing the answer, you lose a mark. So phagocytosis indicates the engulfing of the microbe by T lymphocyte, but not by B lymphocyte. B lymphocyte makes antibody, and this antibody fight against microbes. This antibody fight against microbe. This is a message we need to understand in detail. Now we are entering into the next major concept is called the cell-mediated immunity is taken care by B lymphocyte. Why? Because this B lymphocyte is very, very important in antibody production, right? So antibody production is taken care by the B lymphocyte, and cell-mediated immunity is taken care by the T lymphocyte, right? So T lymphocyte for cell-mediated, B lymphocyte for humoral immunity. Now only we told about humoral immunity, right? So now we are coming for immunosuppression. So, for example, one person lost cheeks tissue while experiencing the acid um, climax in the sense. Okay, unfortunately, while working the lab, some acid spilled over his face or his skin. So at the time, we need to do the facial plastic surgery. At the time, we are grafting the thigh tissue to fix the issue. Okay, we are taking the thigh tissue and then we are giving it at the cheeks area during the plastic surgery. So this is acceptable. But if there is a major damage, okay, we are taking from the patients who are recently died. For example, yesterday one person died, or today morning one person died. So from that person, we can take the tissue and we can give it to the person who is having the acid accident in the case of eye, right? Acid accident happened, so I need to remove the damaged eye and I need to give the proper eye from the eye bank. All these things are possible by doing the organ transplantation. And I told about the skin graft transplantation. For doing all these things, we need to give immunosuppressive drugs. Why? Because we are taking the eye from some other person and we are introducing the eye into the one person. Sometimes we are taking the uh, tissues from some other person and we are introducing into the damaged person. So at the time, we'll be reducing the immunity of the recipient. So while transferring the tissue from donor to recipient, so the donor aggressiveness towards the um, transplant tissue will be much more. So for example, I'm a recipient. Okay, I am receiving the tissue from my sister. Here I lost most of the tissues in my skull. So my thigh tissue is not sufficient. So I am taking some amount of tissue from my sister or from my neighbor or from any another donor. While doing it, so I'll develop the lot of wrong immunity. So to reduce that immunity, the doctors used to give the immunosuppressive drug. For time being, they will suppress immunity, and once the tissue is getting attached to the body tissue, after 1 week, they will slowly, they will gradually increase the immunity again back to the normal. So these are the things we need to understand in which way the immunosuppression is carried out, in which situation after getting the permission. That is very, very important in terms of discussion. And now we are coming for the acquired immunity. You know very well about the comparability of each and every particular drugs. For example, some are allergic towards antibiotic penicillin, some are not allergic towards penicillin. So depending upon the allergy condition studies of a various patient, we are giving the different type of antibody and antibiotic to make the patient to get recovered very faster. So in which aspect we are giving antibody instantly to a patient? Why? Because in a serious diseases like tetanus, I need to give the instant antibody, or else we can't save the patient at the moderate disease period. So, for example, I am having the tetanus infection, okay, for more than 10 days. So if they're not giving the antibody, I can't survive, right? So they need to give instant antibody. In that time period, antibiotic will not support, right? So like this, in certain period, we are giving instant antibody. In certain period, we are giving antibiotic. In certain period, we are taking the antiviral drugs depending upon the microbe infection zone in our body, and we are getting the clinical parameters screening report, which is nothing but not only the blood, urine, stools report, other body fluids report also. We are screening to give the appropriate diagnosis, followed by the appropriate treatment to make the patient normal. For that to happen, we need to have a adaptive immunity study. So this adaptive immunity is nothing but you are adapting yourself, right? In terms of fighting against the microorganism, right? For that, certain steroid drugs are also given during the recovery period, so that very well in the case of corona condition. So to give the quick recovery, we used to give the steroid injection. So the steroid accelerates the antibody productions and defense soldiers production. So yeah, this is having the positive impact also, negative impact also. So that should be given carefully uh, when we are doing the transplantation, right? And also whenever you're doing the aggressive microbe infection, right? Now we are entering into the next important concept, uh, is nothing but active and passive immunity. So in active immunity, basically, let the microorganism invades your body. After that, slowly you develop the immunity. That type of condition is called active immunity. Whereas passive immunity, I need to treat the patient immediately or else patient will die. So I'm giving instant antibody or instant antibiotic. That is passive immunity, right? So now we given quite a lot of example for active and passive immunity. And in this particular category, we need to understand vaccination and immunization example we already had given. Uh, you know very well, the active immunity example we already had given. Let the person get infected. Okay, let him get the typhoid disease. Let him get the malaria disease. Let him get the rhinovirus infection. After that, the immunity can be developed. There is active immunity. Whereas passive immunity, the body takes a lot of time to get recovered. So there is no issue at all in active immunity. Whereas in passive immunity, if you're not giving to the patient by giving the instant antibody, the patient will die. Now we are coming for vaccination and immunization. That we already told you, the vaccines are having killed or attenuated microorganism, right? So this killed microorganisms will mimic like aggressive microorganism and makes our defense system to produce plenty of defense soldiers to fight against the microorganisms, right? So now, if you're talking about the vaccines of different quality and quantity, uh, here some vaccines we are taking from bacteria, some we are taking from yeast, some vaccine material we are taking from fungus, some vaccine material we are taking from virus, right? So these vaccines are produced in huge concentration to serve the population at a very cheap price. You know very well the hepatitis B vaccine is produced using the yeast. Okay, and hepatitis B virus, if it is invading our human body, then what will happen is it is very very aggressive in terms of performance, and it makes the patient to die. So hepatitis B vaccine is given compulsory for most of the patients and for most of the people who are living in that particular area where this hepatitis B virus is more prevalent, right? So now allergic reactions. Okay, some are allergic towards the antibiotics, some are allergic towards the dust particles, some are allergic towards the water medium, right? Different people are allergic towards various components, right? So we given a number of examples. When you are inhaling the dust particle, when you are inhaling the microbes, okay, you will be getting the infection. So, for example, some of our friends, when they are taking a, very well, the tapioca, they'll get the skin rashes. Some, whenever they're taking the nuts, cereals, pulses, they'll get the skin rashes. So it varies from person to person. Okay, that particular allergy condition is because of which particular food we need to understand, and we need to give the particular anti-allergen components to save the patient. Why? Because certain allergic conditions will make the patient die very fast. So giving steroid drugs, antihistamines and adrenaline is a very classic drug therapy, which makes the patient to get recovered from this issue, right? So now autoimmunity is immunity, which is developed by um, the genetic disorder patient. For example, um, in the thyroid diseases, one of the thyroid diseases called Hashimoto thyroiditis. Thyroid cells are getting destructed unusually. So, because our own antibody recognizes our own body normal cells as a foreign body. So, alien cell. What is this? Alien cell. The alien cell, the word we are saying for which one particular category like this we are saying. Again, back I'm repeating. So, the alien cells, basically, the alien cells, if it is recognized as alien, not a problem. But our normal cells are recognized as alien cells by our body defense system, then it is a problem. So in certain genetic disorders, the antibody are working against our normal cell. That is the condition is called as autoimmunity. Okay, this autoimmunity is a severe disease, and in this particular disease, what are the consequences we are observing? For that, I already had given the example in Hashimoto thyroiditis. In Hashimoto thyroiditis, what type of issues we are examining is the thyroid cells are destructed. Thyroid cells are destructed, and most of the thyroid cells are damaged. Okay, and now we are entering into the next important concept. Rheumatoid arthritis, our own body antibody makes the bone cells to get destructed in the aggressive way, right? So now we are entering into the immune system in our body. We know very well before entering into the immune system in our body, not only the lymphoid organs like spleen, bone marrow, thymus gland, pes, pages, okay, lymphatic nodes, okay, lymphatic vessels, all these things are classic in terms of giving the immunity support to our body by making the different type of WBC circulation depending upon the need of the particular organ to fight against a microorganism, right? So if you're entering into the lymphatic nodes are very classic in terms of fighting against various microorganisms, right? So you know very well our bone marrow makes the WBC, whereas if you're talking about the place where the WBC are going for destruction is nothing but the spleen, right? So these lymphatic organs are circulating the lymphatic fluid. In the lymphatic fluid, WBC is getting circulated. When the WBC is getting circulated, it is experiencing the microbe. While experiencing the microbe, the while experiencing the microbe are killed. Microbes are killed. So we discussed in this particular concept so many questions we discussed. State any two application of stem cells in human disease. We know very well the one main advantage is we are replacing the damaged tissues with the stem cells, and then we are treating the leukemia with the stem cells. Means leukemia, you know very well, the white blood cells cancer, WBC cancer, we can treat with the stem cells, right? So now we'll go to the next question. In the case of immunity, uh, this question is taken from previous year's board paper. A time-bound vaccination program is followed for the children in our country for their birth up to the 10 years of age. Um, we need to understand this graph properly, and then we need to say the answer for this. Okay, either or option. So both the options are completely belongs to the health and disease chapter, right? So for this particular chapter, so again back I'm saying this is a 5-mark question. So your answer should be in a systematic order, point by point, in detail for understanding all the concepts in detail, right? So examples, can you see this? We given the examples and we given the narrations of each and every examples. This is the way your answer presentation should supposed to be, right? So so now if you're talking about uh, so first of all understand, okay, what is called chemical name of SMAC? It is a narcotic drug, right? So this narcotic drug, how to write it properly in your answer script? Okay, SMAC, a narcotic drug. okay, causes the neurological disorders. The concerned human being can't communicate properly while doing the various body activity. So like this, one by one, we need to write in a periodical order, or else we can say point by point. Narration is very, very important to get the maximum score. So now we are coming for the next basic information is question number 3. We are entering into the question number 3. Okay, the decrease in the T lymphocyte count in human cells will result in decrease in T lymphocyte, right? So the decrease in antibody, okay, decrease in T lymphocyte. Why? Because T lymphocyte count, okay, increases the antigen. Yes or no? So here the reduction of the production of antibody that are essential for fighting infection, right? So this is the answer for this particular question. So now I already told you a number of times, B lymphocyte makes antibody, T lymphocyte fights against microbes by doing engulfing the microbe, right?